who live in the United States, Canada, Europe, Japan, and the Middle East have ready access to hospitals when we are sick or injured. We take it for granted that if we have an accident or a sudden illness, that emergency personnel will transport us to a well-equipped hospital for treatment. But that access is not widely available in the poorest areas of the world where the Order of St. John Paul II operates. On rare occasions, news of disasters in poor areas overseas reach those of us living in the more affluent areas of the world. Reuters and Al Jazeera provided in-depth coverage of the November 5, 2021 gasoline tanker explosion in Freetown, Sierra Leone that killed at least 144 people and injured hundreds more. We saw on our news images of the horrific flames and the emergency responders trying to save the injured people. What we did not see, because our news agencies felt the scenes were too disturbing for public consumption, was the hundreds of burned people waiting to be treated in the hospitals that were not designed to handle such mass casualty events. Even hospitals that provide routine prenatal care or care for people suffering from malaria or acute respiratory infections have challenges. Many hospitals in sub-Saharan Africa don't have reliable clean water systems, washing facilities, and appropriate sanitation systems. Those that are equipped for surgical procedures do not have access to reliable electricity, nor are they equipped with emergency generators for when the electricity fails. Imagine doctors and nurses performing a life-saving operation and the operating theater is thrown into darkness when the power inevitably fails. The Order of St. John Paul II is committed to help address these critical healthcare issues.
We are aware there are a lot of infectious disease coming into the clinic, and so this will be the first port of call. When you come in, instead of going straight to the hospital, you come into the triage where various tests are done before you are allowed to go to the main hospital, just to prevent diseases that may come up. So the entrance is actually here. This is brand new. We have not even commissioned this building yet. We are hoping that by end of September we will commission this triage, which is also so necessary for hospitals these days, especially if we have just experienced COVID and other things. When the patient comes, they are totally scrutinized here before they can have access to the hospital.
Moment we are at the back of the maternity block, Christ the King Hospital. We have a building, we have our operating theater, we have 6 beds for labor cases. But our key challenge now is a proper wash facility for the maternity room, wherein we can have our toilet facility, we have our laundry for our inpatient to have access to the laundry and to take care of them. So as you can see, the place is not too good looking here. We're trying to have a sockaway for the back. Then if it's possible to have a good wash facility here so that we address this need.
IPC standards that we're trying to set up across, facilities. Christ the King Hospital happens to be one that really needs crucial intervention on IPC, and wash is a significant need. And especially when we have a maternity that is having over 75 deliveries on a monthly basis. That's huge, and there are tendencies that that's increasing because of the fact that we have a doctor that can perform gynecological related surgeries, and many more will want to come. So why not support such a facility? It's very significant, and we will definitely be able to. Maybe Doctor can add a little bit on what he thinks as a medical person.
But you can't have a hospital without a wash facility at all. It's undone. So I think this appeal is in place, and I would like to add my voice so that whoever is looking at this piece of video would understand that we need this urgently. And the earlier they come to our aid, the better for us and the people that we are trying to serve and help. Thank you.
Beginning in 2022, the Order is adopting 2 hospitals in Sierra Leone, one in Makeni and the other in Waterloo. We will be addressing the issues of providing emergency power, reliable and safe water supplies, scrub stations for operating theaters, sanitation stations for hospital staff and patients, and sewage treatment systems. But we need your help. Emergency power generators will cost at least $35,000 per facility. Each water supply system will cost at least $100,000. Sanitation and scrub stations will cost at least $100,000, and sewage treatment systems will cost an additional $50,000. We desperately need your help. You can make a difference for people living in poverty across Africa. Make your generous tax-deductible donation now. You can make your checks payable to the Order of St. John Paul II, P.O. Box 580925, Elk Grove, California 95758. Or if you prefer, you can donate by credit card online at www.sjp2.org. Please remember, if you pay by credit card fees apply and will reduce the total usable donation that you make to the Order. Thank you for your generous help.
One fateful morning, when I wake up from my bed, I went down on my knees to say thank you, Lord, for everything you've done. I know that I'm no better those that have gone. I say thank you, Lord, for your blessings on my life. Let us save lives, oh yeah. Let us save lives, oh yeah. Let us save lives. Look at people dying always. Let us save lives. With little money you give. One fateful day, I took a walk to hospital. Guess what I saw? People lying on the floor. There's no bed for them to lie, neither generator for light. Everywhere we're dark, people suffering day by day. Let us save their life, brothers. With anything you can give, you go a long way to save people's lives. Let us help them provide light, so that good facility will be done, yeah. Let us save lives. Let us save lives, oh yeah. Let us save lives, oh yeah. Let us save lives. Look at people dying always. Let us save lives. With little money you give, let us save lives, brothers. Remember this what we are today. We came empty hand, an empty hand we should go. No sense we go with us. The best thing we could do is just to help our brothers and save lives. The major you give, so the major you shall receive. Let us save life. Let us yeah. Oh, let us save life, let us save life, let us save life, yeah. Let us save lives, oh yeah. Let us save lives, oh yeah. Let us save lives. Look at people dying always. Let us save lives. The little money you give, yeah. Just in sudden day I met a good man, a good friend, a very rich friend. And he told me that IG for Jesus. I love giving out to the poor, I love to save life. And that is why God has been blessing me. And right from that very day I felt it. And I said I want to save life. I don't know about you. Will you save life? Join hands together with others St. John Paul II and save life. Look at people dying in hospital. There is no light for them. Can we provide a facility for them so that better operations, better health facility will be given to them? Let us save life. The world will be a better place.